Hello, I'm Tyler, and this is my case against universal health coverage. The UN Sustainability Goal number 3.8 is to achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. I am here to contradict this already debated proposal to the solution to global health crises. Most proponents standing against the implementation of universal health coverage are also strong proponents of free market capitalism, a system where the consumers, not the government, regulate the market. All leading capitalist countries, like South Korea and America, use and will continue to use this philosophy to run their economies in the best way possible. Since consumers regulate the market, but the free market system also offers excellent economic freedom to the people and also offers them a substantially significant chance of monetary success. This type of freedom is simply non-existent in socialist governments, which usually implement capital control upon its economy, limiting the consumer's ability to buy and sell assets, and taking the power of the market capital entirely out of the citizens' hands. Now that I've given a brief summary of the definition of a free market economy, it is now time to delve into the main topic. Universal health coverage is counterproductive to healthcare and medical advances, the free market, and most important of all, the people themselves. This topic has been widely discussed and debated upon since the very inception of the philosophy that all citizens should be able to access free healthcare. Free healthcare's most noteworthy opponent was the great Milton Friedman, who was perhaps the most influential proponent of the free market throughout his career. I am here to reiterate his ideology in my own words, as I believe that our society today is in desperate need of the great economist's wisdom and knowledge. I believe that it is the poor teenagers and those minorities suffering from the lack of free healthcare, as the reasons why the political left is suggesting this outdated initiative that is supposed to serve them well and also serve all other people well. While it may be the right moral decision, it is far from the correct decision needed to progress the economy and the overall livelihoods of all the people all over the world. It is a socialist idea that reduces the incentive and competition in the marketplace, a subtopic I will discuss shortly. An additional lesson that is needed to be learned is that equality does not equal equity, and as Jordan Peterson puts it, pursue equality of opportunity and not equality of outcome. Now, without further ado, here's my first point: the lack of incentive. First, a universal healthcare system can result in the deterioration of big pharma's incentive to invent and discover new and improved medicine that will lead to the betterment of the world's health and the increase of the world's universal standard of good health also. The government will already be emptying its empty pockets to fund this program, and we will subsequently see a significant budget cut. The government will force down payments for physicians and pharmaceutical companies. The government will also exclude advanced, high-cost treatments for patients for the sake of saving money, meaning that there will be less innovation and less public access to the existing innovations. In December last year, President Trump signed the $1.4 trillion budget package for use in health and medical research for the fiscal year 2020. Of that 1.4 trillion, $41 billion was allocated to the National Institute of Health, the NIH. And under a universal health coverage system, the budget allocated to the nationally funded health research organizations will shrink substantially. Former Democratic presidential candidates Bernie Sanders and Elizabeth Warren are already planned using totals of $47.5 trillion and $52 trillion respectively before they fell off the election. UHC will also reduce the quality of healthcare itself, as the doctors will lose the incentive to perform at the level they would for the money they used to earn from the government. This will most likely lead to more accidents, deaths, and more reasonings behind my standpoint on this issue. Also, the lack of compensation will also hypothetically result in the decrease of doctors in the future, in the case this program is implemented. The medical profession, especially that of the physician, is long believed to be highly sought after because of superficial reasons, i.e., money. If that reason is negated and no longer applicable to the profession, the incentive for teenagers and young science majors to go the extra mile and get a doctorate would drop. So in aggregate, free healthcare is not suitable for the medical community in terms of researcher/physician compensation, research and testing funds and budget, and practical utilization of new medical innovations, and finally, the creation of new medical innovations itself. Now for my second point. Taxation. As the government tries to gather enough money to run this socialized healthcare system, as Milton Friedman put it, it is inevitable that taxes are going to rise to a ridiculous rate. This means that free healthcare is not free, and the taxpayers will pay for healthcare in one way or another. This logic is directly applicable to all government programs. You or your parents, the taxpayer, are paying for all of that. Bernie Sanders has suggested a tax reform to fit the potentially increased budget that would have taken place if he had become president. It has a ridiculous spike in income tax rates as it nears the top 1%, which suggests the makings of a socialist nation, which we don't want. It trumps the current tax rate for the top 1%, which hovers just over 30% by a preposterous margin, sitting only under 60%. Also, under Sanders' universal healthcare plan, the U.S. budget deficit would have grown about $14 trillion, and there would be an $11 trillion overall tax increase, as you can see on this bar graph. If this type of healthcare were to be implemented into a third world country, where literally everybody except the top 1% wants affordable healthcare, it cannot be implemented into the existing capitalist system, which no one should even consider changing. Also, if everyone under 50% were given tax benefits, the top half will have to pay more taxes than they would under a privatized health system. There is no public demand for a socialized healthcare system. It is merely that the public was led to think that it was all free. And who wouldn't like free stuff? Obamacare was a good example. No one pleaded for it, but it got metaphorically shoved down the public's throats, while the government asked for more taxes for what the majority of people didn't want or need in the first place. To conclude this presentation, I would like to read a quote from Milton Friedman on the term national health insurance. It is not national health insurance. There's nothing national about it. It's for individual people. There is no health about it because it will make medical care less good. It will worsen the health of the American people. And there is no insurance about it because it's simply a government payout, government subsidization. Thank you.